program will not even be possible. So, Dr. Sawh, welcome.
Thank you.
Yeah, lots going on. There are interesting modis in the country.
Yes, exciting.
Yeah, exciting times, yeah. Tonight we're discussing erectile dysfunction, and erectile dysfunction has so much of a stigma attached to it that even bringing this topic up at forums like this, some people don't even want to be involved. But tonight we're going to take the bold step and talk about this. It's International Men's Day, and I don't think that we could have done any better than to discuss erectile dysfunction and men's health tonight, because without proper health, from what I got to understand, if you don't have the right type of a healthy body, then obviously you're going to start suffering from erectile dysfunction. And there are so many questions I want to talk to you about tonight when it comes about erectile dysfunction. Some things that happen here, and there's some, as I said, the subject is taboo, but it got to be brought to the fore, and nobody better to deal with this subject tonight than you. But before I ask you so many questions that I have to ask, I just want to say to our viewers that share this with people, share this on your page so that everyone can join this. We thank you so much for joining us. I know that we have some very, very. I just want to say that these Auntie Gita and Natasha and so on, they're always joining us. So, ladies, I know that you're always there. You always send your questions. You can still send in your questions. This is not limited to men only. Doc, but to start it off tonight, what is erectile dysfunction?
All right, so I'll come to that in a minute. I just want to say to the guys out there, Happy International Men's Day. I think it is only appropriate for us to talk men's health in general. I don't want to really confine it to erectile dysfunction, but that's a big topic in men's health. So the team generally, we want to talk more broadly on it, and of course to cover erectile dysfunction. As you rightly say, it's a taboo. So last week we spoke about menopause, and some of my friends calling me and say, Doc, when are you going to talk about men's issue? Now, I just want to draw a distinction here, and for us to understand health in general. And when we talk about men's health, and I just want to give some focus on, because it's International Men's Day, I want to give some focus on men's health in general. Now, generally speaking, when you look at all the health outcomes and visit to doctors, it is well established that men don't visit doctor as often as or as they should. And there are lots of reasons for that. One, they may be busy attending to family matters, they're working, getting time off and all of that. However, there are also that factor of, oh, I'm strong and I'm healthy, I'm macho, and, you have to portray that. But I want to say that a man is affected equally like a woman with all the health conditions as you would see out there. And of course, there are unique conditions that are for men and women. But let us define health before we go on to the topic. Health is not just the merely absence of disease, as to the WHO definition. It's a state of physical, mental, social well-being, and I would say emotional well-being.
Yes,
right?
yes.
So big on this topic in men's health, I suppose if time permits, we will probably go on to talk a little bit about mental health and,
that is one of
emotional and other issues.
Because those are some of the things I want to ask you about, actually.
Yeah, because that usually people don't come forward to talk about them, and of course you have to give the prompt, and that's why in the management of disease conditions generally there is also that factor. When we talk about patients with heart disease, we also, and diabetes, there should always be a yearly assessment for depression and mental health issues, because they're consumed a lot of time by the thing facing them, but the unspoken issues are not addressed. Okay, let's talk about erectile dysfunction to start it off with, and then we'll go on to talk about some of the other things more broadly. Now, what your question was, what is erectile dysfunction? So it is defined as the inability to attain or maintain penile erection sufficient enough for sexual satisfaction and performance. So that's the definition.
Right.
So you either can't attain the erection, or you attain it, but you cannot maintain it to derive that sexual performance and satisfaction. And as we know, the organ, the penis, is an organ that receives blood. The reason why you get an erection is to do with blood flow. And there are so many causes if we were to go on. So that answers your question in terms of the definition.
Yeah.
But let us look at some of, what causes it.
Yeah.
So there is no one cause to it. And broadly speaking, so if we understand a little bit about the physiology or how it happens, then we will understand, what are some of the causes and how we can pinpoint it. So when you look at how do you get an erection, we know that it is blood flow that goes there. So generally speaking, it's a very complex physiological process that happens in the body, because you can think of something and you can get an erection. You can have tactile stimulation, touching, you can have an erection. So if I were to describe it, so it's a combination of chemical, neurologic, so brain and chemical in the brain, vascular, that's to do with blood vessel, so it's blood flow, hormonal, it gives you that urge, your hormones, male hormones. It's a combination of those factors at play, and it operates in a very, a complicated process. So there are stuff happening in the brain. So just that, if you don't invoke those chemical and you don't have that good feeling factor, there's a system in the brain, the limbic system, as we call it, there, special pathways to where the nerve impulse is transmitted. So if you look at processes happening in the brain, it is transmitted down the spine, it goes to the pelvic nerve supply, and then it affects the pelvic blood flow in terms of the blood flow to the penis. Now, big on that, there's a psychogenic component. So psychologically, there are factors at play.
Right.
And so when we look at causes, then we start to dissect, strip all those, that complex mechanism that I've explained, we start to strip it down, break it down. So let us look at some of the causes, so psychogenic causes. So these are anxiety, mental health issues that can affect you, people with depression, anxiety disorders, performance anxiety is a big one, relationship issues. So these are your psychogenic causes. And then we look at what we call organic causes, or the other causes. And I talked about neurological processes in the brain. So people who have got degenerative brain disease, patients who have got things like Parkinson's disease, multiple sclerosis, and where the brain is affected, it affects the chemical in the brain. As you come down from the brain down, you have your spinal cord. So patients with injury to their spinal cord, they can have issues there. As you get down to the pelvic organ, you have nerve supply and blood vessel. So, by and large, however, I must say, the most common cause that we see, so we have a lot of psychological causes, psychogenic causes, and then we see a lot of vascular causes. So those two causes are probably the most common that we see. Yes, you'd see it in neurologic patients, but when I say patient, when we talk about patient presenting to the doctor, they are that category of patients. Now, I want to just draw attention also to the genitourinary system. So anatomically, so there's an anatomical component.
Yes.
So when you look at what is it? It's a penis getting blood. So the anatomy of that penis and that structure around there. So we talk about the penis itself. There are conditions of the penis, like if you have something called Peyronie's disease. Sometimes you have angulation of the penis where it's twisted or bent. So the tissue can be fibrotic and it causes pain. So that by itself, so any condition of the penis that gives rise to pain can affect erection. You can have ulceration, you can have infection, so all these things. And you look at testicular causes. So the testes, as we know, produce hormones to give us that sexual drive. And if there are issues there, of course, you can have low production of your hormones. And so we've covered almost all the causes. But when we look at, okay, let's say I said vascular and psychogenic, so I'll come back to that. But the vascular causes would be, what are the things that affect the blood vessel? Mm-hmm. They are the same things that affect heart, cardiovascular disease, stroke, and heart attack. So when we talk about stroke and heart attack, what do we look at? We look at diabetes. We look at high blood pressure. We look at cholesterol. So those are the very things that you would pay attention to when someone say, right, I've got an erectile dysfunction. We go on to assess them with that in mind.
But so I'm also thinking here that if someone comes to you with and there are signs of erectile dysfunction, would you use that as a precursor to say also, I need to check your heart also?
Yeah. As a matter of fact, some clinics that is routinely done because, as I say, if we identify that, okay, this is a vascular, so you're not going to get a young patient, for instance, a patient in his 20s with no history of vascular disease, that is no diabetes, high blood pressure, cholesterol issue, a patient at, let's say, 25, come to you and say, doc, I've got erectile dysfunction. Always, I would say that is more than likely psychogenic. But not that would be dismissive of the other causes, but a good history is very important. So, yeah, you'd always think of that.
Mm-hmm. So people who generally suffer from heart disease, is it very common in them to have erectile dysfunction?
Yeah, I would say yes. Because remember the heart, when we consider heart disease there, we are talking more than likely you're talking about ischemic heart disease. So I explained the heart before, that the heart has got other parts like the muscles of the heart and the valves and those bits. So probably those things, not necessarily, but I'll tell you by extension, they can cause it. But if there's blockage of the blood flow of the heart, you would have some degree of blood flow blockage in the penis. But more also importantly, lots of the medications that are given for heart disease can also affect the erection.
Okay.
So, and that's really I would say lots of patients are worried about that. And I want to clear this up, and I want to talk a little bit, spend some time talking about that when we go on to the drugs. Because if you're saying, we're saying here that, okay, heart disease could be a precursor for erectile dysfunction, could be a precursor for heart disease. Yeah. Yes, there are sometimes routinely patients present with that. They go on to have stress tests and checking the heart. So yeah, we should always do that because some of the same causes, they're linked on both sides. But if we look at what do we do generally first? If a patient were to present, so we take a good history to say, okay, tell me a bit. So we take a sexual history, we take past medical history about, do they have diabetes, do they have high blood pressure? We want to know also what drugs they're taking. So there are two types of drugs. There are prescribed drugs and there are over-the-counter drugs and recreational drugs. So recreational drugs can cause it. Cocaine, marijuana, all those drugs can also cause erectile dysfunction. Alcohol, smoking, these are linked. As we know, smoking affects blood flow. Like the heart disease, we will tell patients not to smoke. Patient with erectile dysfunction, we will tell them also not to do that. So when we investigate we will look at diabetes, high blood pressure. We look at cholesterol. We'll check your sugar. We'll monitor your blood pressure, and then we'll do some hormonal test. So bearing in mind the causes, that's how we look for testing to rule all those things out. That's it.
So all right, so I got a couple of questions here that came through so far. Let me see. So this person is saying that their mental is common, but the erectile is okay. Learn something new tonight. So the person is saying that they can be mentally okay, but still have erectile dysfunction too.
Correct. Yeah. So as I say, psychological causes can be one of the causes, and then you have other causes. So if that person, there's no psychological issues, then we have to look for other causes.
Yeah, so this other person is saying that, doctor, fear is one of the factors men don't go to the doctor.
Yeah. We need.
So is it fear or is it the stigma that is attached? What is it really, Doc? Most from your experience.
I think there is a combination of things, as I highlighted earlier. So men are always busy. They're the breadwinner usually, in lots of times, and lots of times we wait for things to happen to us. We wait for us to express symptoms before we go to the doctor. And also, yes, lots of people we have, I wouldn't say the majority, but because by and large now with social media and all of that, we are more aware, and all these campaigns that talk about men's health and cancer and all of that, we're more aware. So people are coming forward more to have health checks and all of that. But there's an element of fear always that, okay, what about if I go to the doctor and he tells me something that I don't want to know. I don't want to hear. I'm fearful of that. So we will consider that a type of anxiety so there are health anxiety disorders. So we can consider that a type of health anxiety. But yeah, we will. I always encourage men to talk about it. And I think it is important for the women who are in our program and who are listening as well. I would say they should encourage their husband and their, other family members, the male family members, to say, yeah, you should have a health check equally like I have a health check. You should see a doctor. You should take your tablets. The thing about health generally also, as I say, lots of the medication, people are worried that if I take this medication, it's going to affect me. It's going to affect my performance. And, that's a little, something we can talk about.
But Doc, a lot of times I'll tell you, I mean, let's have a frank conversation here too, that a lot of times what happens is that us as men, we probably think when we're younger that, and even some into the mid to late ages, is that we always think that we're invincible, and we eat anyhow, we drink anything, we generally don't go about the right way of taking care of our bodies. How important is it to really take care of our bodies especially from I mean, you talk about drinking and so on, but what about the eating part of it? How much does that affect?
I cannot overemphasize the role of lifestyle, and that is diet and exercise. Diet meaning the type and the quality of food we're eating and how active we are. Now, all these conditions, when we talk, all of us know this, the world over, vascular disease, cardiovascular, heart, stroke, erectile dysfunction, they're all classed as part of vascular diseases. And we know that lifestyle plays a big, big role. And the earlier, you see, there are times when if I'm going to the gym and I'm feeling active, I'm feeling healthy, I want to maintain that.
Right.
Now, if I, allow my body to just go, you don't get that urge, you don't get that.
Difficult to pick up.
And it's difficult to pick up. So that's why I say it is very important. Let us start it early. Let us encourage. Even though nothing is wrong with you, you're healthy, you're slim and trim and active. Let us reinforce those things and let us continue doing that. Shall we go on to talk about how do we manage it?
Yes.
Or
yes.
do you want to take some questions?
Well, I just this person said, there's someone who says, people are asking, Doc, can it be fixed?
Of course. Well, that's I'm going to come on to.
Right. So go to fix, and then some of them do hoping for a quick fix, but then they are disappointed and it becomes worse. So can it be fixed? And are there quick fixes, or this is a process that has to be? You tell me, Doc.
Both. There is quick fix and there is long-term fixing. First of all, we want to identify the problem. So if I want to just bring up a slide on treatment. Robert, if you put up treatment, I just want to say, how do we manage erectile dysfunction? And I just, came up with a little bit of order, how it's done generally, and then I'll touch on each one of them. So we talk about lifestyle modification.
Yes.
So lifestyle modification would be, that's your diet and your exercise, and you stop smoking, and you cut down on your alcohol. Sexual counseling, so that is your psychotherapy. So in patients who have, for instance, we identify that this is psychological causes, we forward them for sexual counseling. Let me just expand a little on that, on sexual counseling. So as I said to you, if I have our guy who has got heart disease. He's on lots of medication. He presents with erectile dysfunction, and it's a gradual something. I would say, fine, maybe he has got a genuine organic cause. If I have a youngster who present with, oh, I've got a new partner and now I can't perform, and sometimes he's suffering from performance anxiety, and it has to happen once. And I always tell patients it has to happen. It would only happen once, for instance, and it plays in your mind all the time. And that's a common thing patients will come and tell me.
So psychologically,
it affects them. So we have a way that can be a quick fix. I can say to them, normally what I tend to do is prescribe them some medication. These are guys who really, they're young, they're active, no medical condition, but it just happened once with them, and after that, it's affecting them. They keep pondering, is it going to happen again? So that type of anxiety, we tend to treat it. So what I tend to do is I will prescribe Viagra and that family to them as a short-term use, as a quick fix. So let's fix this, give you back the confidence, because they just want to regain that confidence. And then they can stop after that. And then, of course, you go on. I would still refer them for psychotherapy. Now, I mean, all of this, as I say, as you know, it involves two people. So the whole apparatus the system of sexual intercourse and satisfaction and pleasure involves two people. Right. So you have to have that kind of communication. So you have to have that open line of communication with your partner, because half of the treatment also involves engaging your partner. And I mean,
so there needs to be a chemistry.
There needs to be chemistry, need to be understanding. If for instance, your partner is more demanding on you, and it compounds to the problem. So you don't get it up, for instance, or you can't maintain it, and then you feel frustrated. She feels frustrated, and you don't talk about it. Then it gets pear-shaped. In that, it becomes a little. Nobody addressed the issue. I think this is probably a patient. Should we take that?
Yeah, let's take that. Yeah.
Hello?
Hello?
Yes?
Yeah.
You on the line?
Okay, what has happened to you like that?
Yes.
Is that when I get erect, it'll feel like I don't get hard for long. I want to know forget it on back.
Okay. If I may ask quickly, how old are you? Oh, goodness. We've lost that caller. That caller asks that he gets erect and it stays long, stays hard for long. A number of reasons. There are certain medications, so you need to know a little bit of a history. There are patients on certain drugs that can cause it to be a little bit more prolonged. Also, if there's constant stimulation where there is no release. So I want to know, is it during intercourse that he is having this and he doesn't ejaculate and he doesn't have that period where it goes down, or he just maintain that and he doesn't have, so he may have some sort of condition where he has prolonged erection and not ejaculated.
Well, he didn't stay. But we didn't get. He didn't stay long on the phone.
Yeah, so I hope he's going to call back.
But also let me say it. If you're using medication, let's say you're using Viagra. In Guyana here, there's a very common one. I don't know if you've heard of it. It's generic. It's a generic
Comagra.
Comagra, right?
All right. So let's come to I went through the treatment, lifestyle,
right?
Psychological, sexual counseling. The next one is oral medication.
So I was going to ask in relation to him. If he took oral medication and that,
of course, sometimes it could be, but that's what I'm saying. Some medication,
right?
So we got to know a little bit more of the history.
Yeah.
So oral medication. Well, he's back online. Yeah. Okay, I'll take the call. Yes. Hello, caller?
Yeah, the phone cut out. Yeah, so I was saying, how you can get it on back.
Right, so my question is, a couple of things. Is this from you being stimulated, or is this a natural...
No. What number take place? I just ride a lot. So, the legs, the exercising, and I was riding work.
So do you have an erection spontaneously and it doesn't go down back, or do you have...
only when I'm sexing.
Okay, when you're having intercourse, but would you normally ejaculate and have an orgasm or not?
Yeah, break and thing.
And
but when I break, I don't go wrong back. It's like second man to go wrong back.
Right. Do you have any known medical conditions, like blood disorders?
No. I'm a cyclist. I'm a cyclist every day to work, you know.
So you're young and healthy, and you don't have.
I'm 34, you know.
Well, when you say long, what are we talking about?
Well, it takes like a half an hour, so like to go wrong back.
Okay, and that is without stimulation and after ejaculation.
Yeah, when I'm done breaking.
So I would probably.
When I go out for pee, I'll just sit down now, you know.
Yeah. I would suggest that you see a doctor. We would want to run some blood tests because there are some conditions of the blood, some blood disorders that can cause that to happen. So we would want to know if your blood is too thick. We would want to know, a few things. So I think we need to run some tests and see what else is going on.
And I can't go again, and it's not go wrong.
Yeah. So, well, we have to, I think you need a little bit of investigation to establish if there was another cause for that. And you don't use any recreational drugs, do you? Do you use...
No, as I told you, I'm a cyclist.
Yeah, of course. I mean, lots of people exercise and they still use other drugs, but that's fine. I'm happy that you don't, but I think we need to then investigate a bit, run some blood tests and hormonal tests and see what else is going on.
Every day I was running 20 km to work.
And also certain, I don't know if you do any horrible stuff. There are some horrible stuff that's got, plant products that have got, I'll come to that when we talk about some of the things that people use. So if you do any of that, so my advice would be see your doctor, have a little chat, let them do a little investigation and see what's happening.
My wife doesn't want to see doctor because she loves it. She wants to go again and again.
All right, we don't want anything personal on here, but nevertheless, good. Oh, you take care. Thank you for calling.
All right.
Cheers. Bye-bye.
Okay.
Yeah, so you can call, you can call in, or you can encourage people to call in. Yeah. Numbers on the screen: 231-2982, 610-1066, and 652-1314.
Robert, let's get a slide.
I think a lot of people. Who listen to him, men who listen to him, might say he got a good problem.
Yeah.
Right.
Of course. In many ways, that's what we're looking. But as I say, there are certain blood conditions that can cause it to happen, and also your hormonal levels, and we'd probably have to investigate if there was any underlying cause. Robert, the slide with oral medication, and you talk about Camagra and Viagra and all of that. So oral medication, as we know, so oral mean that's the tablet you're taking orally by mouth.
Yes.
And it comes in different forms. So the drugs. There are a family of drugs called PDE5 inhibitors. Mm-hmm. Right. And the common one that you know about is Viagra. Mm-hmm. But the chemical name is called sildenafil.
Right.
So they have sildenafil, which is Viagra as a brand name, but Viagra is marketed by a company called Pfizer.
Pfizer, that's right. Yeah.
And they make that brand Viagra.
Yeah.
But the chemical in the drug is called sildenafil.
Right.
Now, another company will make it, and they will call it a different name. Mm-hmm. So, Camagra, that we have available in Ghana, is the same chemical name as Viagra. So, Robert, if you put the slide up, I'll just show some tablets here. All right, never mind, don't worry, I'll just talk through it. So, okay, right. So, you have Viagra can come in different forms, right? So in tablet form. The Camagra, similarly, they can come in tablet form. They come in some jellies, some liquid jellies sort of thing that you use. And so you use it like half an hour to an hour before intercourse. And it is a short-acting. So there are short-acting and long-acting type of family of those drugs. So you heard of the one called Cialis?
Yes.
Right. Yeah. So Cialis is the same family. So the family is called PDE5 inhibitors, right? Mm-hmm. So you get Viagra, Cialis, which is tadalafil, Viagra, sildenafil. You get Levitra, vardenafil. So those are the different names. And the difference really is the onset of action and the duration of action.
Okay.
So the Cialis is a long-acting one. That can stay in the body like 15, 20 hours, 17 hours on average. That what we say, no, it stays longer, but that's what we call a half-life. So half of the drug is metabolized by that time.
Okay.
So it can stay for a couple of days.
Oh, wow.
And then you have Viagra, which has got a half-life about 4 to 6 hours, probably, around that. So that's when half of the drug is metabolized already. And the onset is between 30 minutes to about an hour, hour and a half. So the idea is to use it, and it comes in different dosages, 25, 50, and 75. Now, 25, 50, and 100. So normally we will tell patients, I'll start at a low dose, 25. If it's helping, then that's fine. You stick with the lowest dose. If not, the second time you go on the 50 milligram. If nothing happens, then you go not on the same time you take them successively, is on the next time you're going, another day, you take the higher dose. So you take the dose that is doing the job. Now, there are a couple of things. Yeah, go ahead. What are you going to say?
No. Go. I'll ask the questions after. Yeah.
No, I just want to clarify. So, Camagra, that is widely used in Guyana, is the same Viagra. Let's say that. It's just a different company making it.
Same active ingredient.
Same active ingredient, nothing. Now, there are lots of things online that people will go and buy, because men generally, sometimes they don't want to talk about it, they don't want to go to see their doctor, and they want to do it a bit secretly. Now, there are some downsides to Viagra, but when it's a downside, you need to be assessed what other medication you're taking. But a point I want to make about Viagra that lots of people are afraid of, and I want to say this to everyone. Patients would come to me all the time and say, Doc, I've had a heart attack, and I've had stents, or I've had a bypass, and I was told I can't take Viagra. The answer is, yes, you can take Viagra, 100%. As a matter of fact, those are the patients who need it the most.
Yes.
I have got thousands of patients I've put on Viagra with stents in.
Okay.
Who've had bypass surgery. Okay. Because we know if I'm going to fix your heart, now a fulfilled life involves, sexual pleasures.
Yeah.
And if I'm going to fix your heart to live till 100, and you have a problem, erectile dysfunction, we want to fix that as well. But the caveat here is that, okay, you're not going to prescribe Viagra just after a heart attack or a surgery. Mm-hmm. You'll give it after a couple of months, patients are stable.
Right.
So once you're stable, you're drugged, you don't have an angina symptom. So even though you have a stent, you have a bypass, you can have other vessels that are blocked that can give you angina. So once you're asymptomatic, I'm taking my medication, I'm okay, fine, I'm having erectile dysfunction, because some of the medication, like beta blockers, as a matter of fact, lots of blood pressure medication can give rise to erectile dysfunction to an extent. The second thing we got to be careful of is patients who are taking, these cardiac patients who are taking a drug called nitrates. So nitrates are the spray that you put under your tongue. Mm-hmm. They have it in tablet form that you put under the tongue, and they also have tablet that you drink, that you swallow. Mm-hmm. Now, they are called nitrates, and what they do, they expand the blood vessel. But Viagra does the same. It expands the blood vessel so you have more blood flow. So the intention is that if you're going to take the nitrates and then you take something that expands the blood vessel, what tends to happen? You have low blood pressure. Because the vessel expands, you have pooling of blood, the pressure drops. Right. So we would not advise patients who are on nitrates to take Viagra. And just to be careful also, your blood pressure medication, it is given with blood pressure medication, without a doubt, but you want to know what is your blood pressure, and just to be wary that it can drop your blood pressure a little more. So I wouldn't start at the highest dose, I'll start at the lowest dose. So you take your blood pressure medication and with the lowest dose of Viagra, and then we build it up once it's not causing problem. Some of the side effects you can have, lots of people come and say, Doc, I feel as if my heart is beating fast, I'm getting headaches, I can get a bit of blur vision, I can get a bit of GI upset. These are all normal things. And don't panic, because that's how the drug works. If the drug dilates the blood vessel, it drops your blood pressure, so you can feel a bit lightheaded. You can get a bit of headache. So your heart can beat a little bit faster. So lots of patients can panic about that. I would reassure them and tell them those side effects beforehand. So when they take the drug, they don't start to panic, I'm getting a heart attack. As a matter of fact, Viagra was came out in the 90s, right? Mm-hmm. When they start studying the drug, Pfizer start studying it in the 80s. It was a drug that was developed for angina, for heart disease. And these patients came back and said, Doc, yes, I'm okay with it, and I'm happy with it because it's causing erection. And then the company decided that, fine, that might be the main reason why we should market this drug. And that's how it got FDA approval, American.
From what I got to understand,
late 90s, I think 98.
In clinical tests, the patients were saying that, well, it's okay, but I'm having this, right. So yeah. But it was really like a side effect.
Correct. That's how it is discovered.
Yeah.
It wasn't. The intention was to treat angina, heart patients, and then it came up that they were having those side effects. Yeah. So I want to say to patients, and the viewers out there, just consult your doctor. If you're on a heart medication, you've had stents, you've had a heart attack, there's absolutely no reason why you can't still be on Viagra, provided you're not taking some medication that can interact, which the doctor can review that, and we wouldn't give it just after you've had those procedures or you've just had a heart attack or a stroke. And also people who've had peptic ulcer, like bleeding disorder, sickle cell disease is another condition because they can end up with prolonged erection, and that again is dangerous. So those are some of the downsides. What I would tell patients, okay, I wouldn't give it
before you come off the pill, let me ask you this. Mm-hmm. There's a saying, if you don't use it, you lose it, right? Would you now, if someone is not having intercourse over a long period of time, there's huge gaps, would you advise that they take one of these medication, let's say, well, the one that's, and I'll come back to that, the one that's locally available, readily available is Camagra.
Yeah.
Now, these medication in the US and the UK and Canada are very expensive.
Sure.
Very, very expensive.
Yeah, of course.
It's about $10 a pill or more.
Yeah.
I think.
I would imagine.
Yeah. I think it's probably $1,000 for a card here of 4.
Correct.
This is readily available.
Yeah.
Can there be overuse of this? Because I've heard stories where people say that recently there was a story where a girl jumped out of a room at a hotel, and what happened? The man collapsed inside. He had a heart attack. It was suggested
that he overused.
Right.
So that's what we got to be careful of, right? Yeah. So what tend to happen? Lots of the drugs. I would say if it's not from a reputable company, of course you can have people who mix lots of things in the drug and they can market it, but they don't declare the amount of active ingredient they put into the drug.
Right.
So whereas I think Camagra is a brand that has been around for a long time, and I would imagine that the company that's making it,
I think it's coming out of India.
Right. So the company that is making it adhere to some, ground rules in terms of drug manufacturing. So they would probably put a chemical that is adequate enough. But what tend to happen, there are a couple of things. It's like anything else. You're buying a branded product, which they assure you of quality control. And when you look at medication generally, what we're looking at, I can give you a tablet here, manufactured by a big fancy company, and one that's manufactured in the bottom house. They both get the same active ingredient, but the one that is manufactured from the top-notch company, it works better than the one that's manufactured in the bottom house. And the reason generally is not necessarily the active ingredient alone. In drug manufacturing, it involves a lot of process. Now, you got to look at the shelf life of the drug, how the drug degrades over time. So a drug can lose its potency if it is exposed to the wrong temperature, to light, to environmental factors. So if you store the drugs, so big companies, we would imagine that they would have proper quality control. When they move them from point A to point B, they adhere to all the protocols. Whereas a small company might not be able to afford all those things. It is important. And what sometimes companies can also up the dose of the drug. Our patients use one of the tablet and they say, fine, nothing is happening. Let me take two. That this tablet is too weak. So it's really, it's a difficult one. But I would think that Camargo is available here and we use it. We know the dose. It would be written. So it comes, the active ingredient we're looking at is sildenafil. Minimum dose, 25 milligram. Nothing happens. 50 milligram. You can go 75 or 100. And that's how I would
regular erection doesn't have to be for intercourse, but regular erection tells you a little bit about your functioning of your body and what's happening there. If someone is going through erectile dysfunction, would you recommend them to use lower dosage of these medication normal, once a week?
So there is a study. That's one of the regime that we use. Okay. So we have men with post-operative after prostate surgery, for instance. Mm-hmm. The medical evidence is good. The studies have shown if we give them low dose of Cialis, the tadalafil, I told you there's one called Cialis.
Yeah.
We give them 5 milligram of that every day, and they use that long term, and it helps their performance. It helps it helps them generally. So yes, that's one approach. But it has to do with, are you in a regular relationship? Do you want it as a one-off? Are you, there are loads of factors that come into play when we,
So these are all manufactured drugs you're talking about. Now, in Guyana here, we have quite a few aphrodisiacs, I want to call them, right?
Yeah.
We got number one, Capadula, I got Granny Backbone, Kakshan. Here, I got to take you a day, so let's go to border market. And we got to talk to some of these bushmen, right?
Yes.
And some of the some of the viewers, you could tell me what are some of the things else, some of the other things that you would see locally that can be used. But there are quite a few things here in Guyana, people that claim to be, they got Doc. You have been in Guyana for a long time. Whenever you have heard they say they got one that's selling called Panty Bora, right? I'm telling you, there are so many things.
Yeah.
Now, why is it? Do these things work? I mean, it has to work that these people swear by them.
Yes.
I did a documentary with the bush people there at the at border market, and while I was there, people were stopping to buy one called Bedroom Bully. I kid you not. You can't make these things up. The guy selling it there,
okay.
And he says that Bedroom Bully. I said, what is it? He said, name says it all.
Correct. There's no doubt. There are loads that have been studied, and we know you have drugs. They have the basic principle of how these, even the tablets, how they work. They cause vasodilation, we call it, where they expand the blood vessel.
Right.
Now, and we know that lots of medication are manufactured from plant products. Mm-hmm. So all these bush and drugs that they use or whatever they're using, it has a component in it that cause relaxation of your blood vessel, increased blood flow. Some also work at the neurologic level, where it creates that excitement and that urge, sexual urges. Some also work at the testosterone level, where it works on your hormonal level. So you have, some of the common ones that we research, Yohimbine, you heard of that?
Yeah, Yohimbine. Yeah.
They are vasodilators. Mm-hmm. That's how they work. Ginseng, Ginkgo biloba.
Yeah.
You have
horny goat weed as well.
Yes. That's a big horny
one.
Goat weed. They have some amino acid protein, L-arginine. Mm-hmm. So there are all these products that we know they work by causing vasodilation. They increase the blood flow. Now, the only thing is that we don't know, as a conventional, dealing with conventional medicine, I don't think I know what dose to prescribe of that.
Mm-hmm. Right.
And for how long? Mm-hmm. Is there any downside? Does it interact with other drugs that you're using genuinely? So I would say it has its place. So if I'm I don't have any, I'm living in a remote area. I don't have any other means of getting medication or seeing a doctor, and this has been used traditionally in my generation, maybe I'll give it a shot. So you have to be logical about it. But if I have 101 medical conditions, I'm taking a handful of pills, I want to know, is this really interacting with my medication? Can it cause some other problem? So those are the downside. And as rightly say earlier, they cause increased blood flow, they drop your blood pressure. So if you're on other tablets, your blood pressure can drop too low that it causes problem. So I think
in this country here, we have a problem. We have some issues with. Look, erectile dysfunction is an issue in this country. It's a big. I guess worldwide is a problem. But I tell you here, and I am going to tell you something that I think, and I mean, men. I hope that men are listening to this, and they can share that. A lot of times when men have erectile dysfunction, they suffer from erectile dysfunction. They blame the woman. They tend to say, "Oh, you got another man. That's why me getting it up." Or or they try to think and say something with you. You got to do something with me, or somebody do me something. So immediately we're trying to cast a blame, and that then leads from that initial thing to it becomes a frustration, and it leads to anger, and then anger leads to so many things, and then there's a spiral of emotions that people go through when they have this issue. What would you say to someone who's going through that, and they're basically looking to blame someone else?
No, indeed, and we've seen that a lot, and you heard stories all the time, people telling you these things. Now, it is, you remember, as I say, sometimes men don't want to confront that it is a problem. Now, if it's a one-off problem, probably everybody at some point may have some erectile dysfunction at some point. The statistics says about half of men at some point would have erectile dysfunction between the age of 40 and 70.
But some men go through their whole life without having it?
No. Half of the population between 40 and 70, up to half can have erectile dysfunction.
Okay, yeah.
So my point is, if that were to happen, you don't look to blame that, okay, the woman is the cause for it, but bearing in mind, so there is an element of relationship.
Right. We spoke about that earlier.
Exactly.
Yeah.
But it's not that the woman has got a problem because you are not having it up necessarily.
Yeah.
So you have to look at. But what I would encourage, and your question was, what would I say about that to patients? I would encourage them. Okay, this may be the onset of an issue. Let's talk about it. Engage your partner into it. You say, fine, this is a one-off. You would understand that. And some of the things you can do, in terms of management and how we go about, because I was going to come to some devices that can be used that involves the partner.
Yeah, I think we're going to have to continue this conversation next week and go on to
I'm just going to go 2 devices, and then I will talk on one more thing.
Okay, good.
I just want to, so besides oral medication, Robert, can you put up, there's an injection here, a penile injection. There's one with an injection.
Yeah, you got it up. Yeah.
Good. All right. So there is a drug called Caverjet, alprastadil, right? It's a drug that you can inject into the penis. Again, it increases blood flow. You can give it different form. You can inject it like that, as they're doing, and that's from the internet. It comes in a gel. You can insert a gel into the tip of the penis, and you have different lotions and things you can use. So that's another way of, if the tablets, so lots of patients, the tablets.
So there's a long-term fix or there's a quick fix?
These are quick. Well, you can use it continuously, meaning that, okay, if you're going to have sex 2-3 times a week, you can use it like that.
Okay.
But you're not going to use it for one day.
Right.
You know what I mean? But the point is, that will give you an erection. So that's another way. So if you don't want to take tablets, you can have an injection, but besides the injection, there are cream you can put into the tip of the penis. And it comes in different form. There's a drop now you put in just a few minutes before. You can put an applicator where there's a gel you insert deep into it. And those are different ways of having that drug. And there is two other things I want to talk about. There's one with something called a vacuum device. So we got oral medication. We've got the injection and lotions and cream into the tip of the penis or an injection into it. And then you have a vacuum device. So there is one Right. So that's a vacuum device you put on your penis, and you create a suction, and you suck the blood into the penis, and you put a rubber band at the base of the penis.
A ring.
A ring.
Yeah.
So that's a vacuum device, and they are easy to use, and normally the clinic will show you how to use it. And they're very effective. I've got patients that
this is for somewhat. So you pull the blood blood there, and then you use this
the ring.
Yeah, to trap it.
Trap it.
Right.
Correct. So you maintain the erection.
So you maintain the erection.
Absolutely.
Right. Okay.
And there's now last resort. So remember, you want something to be as natural as possible when you have an intercourse, and that's why most people want to do it in a little bit of a sneaky way.
Right.
I'm going to take a tablet. Nobody knows about it. It's not a big deal. But if the tablet doesn't work, you know that there are other options. So you don't have to say, fine, there's nothing else I can do. I want to tell patients out there are lots of other things that can be done. And the last resort, there's something called penile implant. So there's another slide there with an implant. Correct. So if you look at that, that's a penile implant. So you get the cylinder, that yellow bit is a cylinder that the implant. It has a reservoir on top, that little balloon on top, and then you have a pump in the testicle. You see there's a pump there. So you squeeze that, and it inflates the cylinder.
Right.
And you get an erection. And then you deflate it, you lose the erection.
Oh.
Now, they have different types of surgical procedures. So that's a surgery. They do a surgery and they insert that. I've got a few patients on that. They have some semi-rigid rod they sometimes put as well. And you have that little, rigidity continuously. So there are different surgical options. So, all right, that's it. That's it, Robert. So there are options in terms of erectile dysfunction. We can take a couple of questions, and I want to touch 5 seconds on one brief thing. If I don't talk about this...
No, you have to. We don't have any questions right now, but I think everybody's just saying, we have a good viewership, but everybody's enjoying this. So, tell me.
It will be remiss of me if I don't, because when we talk men's health, erectile dysfunction is a big topic. We'll come back to talk about other psychological conditions. We talked about prostate before. I want to talk about a condition that lots of people don't discuss and they don't talk about. It's called premature ejaculation. Yeah. So premature ejaculation is very common. It's probably the most common sexual disorder in men under 40. And we don't talk a lot about it. We want to know, okay, what is premature ejaculation? So usually it happens when the time of penetration to ejaculation. So you can have two types, which we call primary and acquired. So the primary premature ejaculation, you ejaculate within 1 minute. And then you have acquired one, can go up to 3 minutes. But anything under 3 minutes is still defined. Now, what is normal time for ejaculation? Lots of people ask that question. Studies have shown, so when they look at the average, it's between 4 and 7. So there was a study published where they look at 500 men from the time of penetration to ejaculation for about 5 countries. They pooled the data, and the average time was about 5 minutes.
Okay.
So they say on average between 4 to 7 minutes is normal. Under 3 minutes you can have premature ejaculation. Under 1 minute in patients who have long-standing or primary condition where it happens all the time. And of course, again, this is lots of frustration. It causes a lot of frustration. And a one-off premature ejaculation is nothing. It is defined when we consider it's a problem. It should happen more than 50% of the time in sexual encounter. And there is adequate medication for that as well. So just couple of things. The drug that has been used, so there's a tablet you can use. A member of the family of antidepressant, they're called SSRI, the Paroxetine, that has been licensed to use for premature, is a short-acting form of the drug. So that's one. But some other things patients can do. They have condoms that are selling with some local anesthetic in them.
Yeah.
So they long
delay.
right? Yeah. So you can use that. what I sometimes prescribe to patients, I prescribe local anesthetic. That, when children go to have their bloods done, they put a kind of anesthetic on the vein so they don't feel a numbing agent. So you can put that numbing agent, so it's not very strong, on the penis, on the glans penis, that's the head of the penis, and then you put a condom on. Because
that's for desensitization, right?
Yes, desensitization, but and then you use a condom. So because if you allow that anesthetic to go on to the woman,
that's right.
Then it can cause delay or orgasm.
Right,
and the definition is really actually, when you define premature ejaculation, is when both partners are not satisfied to completion. So if the woman takes longer, you can go on for 10 minutes and you still define it as premature
Somebody
ejaculation.
says here, Doc, I thought excitement causes premature ejaculation. That is possible.
That is possible.
Yeah, that is a genuine.
But as I say, if it happens continuously, more than 50% of the time, then it's a problem, because you can't have satisfied sexual intercourse where both partners are satisfied. And go ahead.
I want to ask you, before time runs out on me, I gotta ask you this here. What is the link between testosterone levels and erectile dysfunction?
All right, quickly, we talk about it. I told you in the beginning that hormones, chemical, vascular, and all these nervous things. So hormone plays a big part. Testosterone is our driving hormone. They give us libido, the urge to have sex. And that can be one of the causes. If you have low testosterone level, you don't have the drive. If you don't have the drive, you don't want to initiate it.
That's right,
And of course,
the body's not going to react.
Absolutely. So yes, I do. In part of the workup for erectile dysfunction, I would normally test for testosterone as well.
Right.
And then patients with low testosterone, there is treatment again for that. We give testosterone supplements, like how women get HRT, men can get testosterone supplement.
Great. This is an amazing conversation today. Doc, we got about 2 minutes more. What would you want to say in closing? I know I hope you got a cover.
Yeah, I think I tried to touch. There are lots of things that we talked about, but I really touch on those two aspects in terms of their big conditions of men that they don't talk about. And the intention of our program is to be frank, and talk candidly about things and
exactly.
And sometimes patients don't bring it out into the open. We have a platform where we can do some public education.
Exactly, that's what we do here. We our job here is to bring awareness to the public and give you a forum where you can ask your questions. Doc, one of the things that I advocate. I have advocacy in many areas. Garbage is one of the things that really bothers me. But since we've been doing this show, at the end of the show, I always talk about the accidents in this country. And today we had so many accidents. Just today alone, there was a massive crash up with two trucks on the on Sherritt Street. Somebody died. The guy's electrical contractor went out to jog this morning, trying to stay healthy. It really bothers me.
Breaks your heart.
Yeah, it really does.
Innocent people go down like that. But my personal opinion, I would say this. My personal opinion is that I see the driving that happens on the road is lots of lawlessness, that people don't adhere to rules. And in my opinion, I think lots of drivers, they don't have the experience.
Yeah.
And I strongly feel this, that when I see you're speeding and you're taking a turn, you're speeding and you're overtaking and you're not aware of what can happen. And it's really inexperienced driving. There are people probably get license without not going through the proper channel.
Look, this is different from what we're talking about all night, but this really bothers me. And at the end of the show, we always say to people to drive safe and all of that. But there are thousands upon thousands of trucks in this country. And I don't think there are enough truck drivers. The moment you could drive a car, or you could drive a minibus, or you're driving a minibus and crashing and killing people anyway. But you're driving a truck now.
Yeah, and with these trucks also, it takes you have to have some experience before you're let.
Yes.
On your own. This could be a public health issue. Look at when you have accidents, you have death, you have illnesses, you have broken bones, and you have hospitalization. So of course it's health related. So it's appropriate for us to talk about it.
Yes. Again, we are begging, we are pleading with you to slow down, to watch out for those who are not watching out for you. You stay, there's only so much you can do. Like that guy was walking, went to run. He didn't put himself there to be, but it has to change. We're up on time now, Doc. It was a really amazing conversation tonight. I hope that we covered these topics, that you covered the areas that you wanted to cover in this topic. But next week we're going to be back here again. I think we should pick up. We didn't get to discuss men's health.
Yes, other aspects of men.
Right. So we're gonna probably talk about that too. So again, man, thanks.
No, thank you for
pleasure always having you here.
Yeah.
It's what you're doing here for the public is lots of people would call me and tell me that that you're such a professional person. Somebody mentioned just now in one of the comments saying that while we were talking to the guy on the phone about his not so much of a problem as some people, men like us, might want to say, but it is. I mean, it's no fun. It's no fun.
Yeah.
It's no fun in it. But the person said that they admired how you were holding a straight face to take that call. Where I'm trying to bite in my smile, but I am, you're a professional. This is what you do, and you bring such a freshness to this, to dealing with health issues in Guyana. Again, thank you so much.
Thank you as well, and thanks to the viewers and the public.
Yeah, so thanks again, everybody, for joining us. We're going to be here again next week Tuesday at 8. And remember, the show, it's here. It's going to be up on the platform, on the Guyana Street page. You can share it with everyone. Thank you so much for joining us. Watch out for those who are not watching out for you. Drive safe and have a wonderful rest of the evening.
Good night.
And stay healthy. Bye.
Thanks. Bye.